Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Srikar Karanam, who is a board-certified emergency medicine physician and the owner of Revamp Hormone Replacement and Weight Loss, a small business based out of the Appleton area that specializes in bioidentical hormone replacement therapies and both medical and natural weight loss solutions. After his residency was finished, Dr. Srikar embarked on a personal health transformation in which he lost over 40 pounds. Through that experience, he discovered that there is a significant amount of conflicting information that people oftentimes need to sift through when on a wellness journey, and he wanted to give people better support and information. So while continuing his work as an ER doctor, he established Revamp in February of 2024. Outside of work, Dr. Srikar considers himself a foodie and loves traveling, hiking, boating, snowmobiling, and camping with his wife and 2 dogs. We recommend listening to this 4-part series in order as the content covered in the episodes do build upon each other. With Dr. Srikar's expertise, we are excited to help you feel informed into the sometimes confusing worlds of hormones, PCOS, weight loss, and more. So let's jump into today's conversation.
Hey, everybody. Welcome back to the podcast. We are so excited that Dr. K is here to talk about all things hormones. Last episode, we had talked all about like hormones, especially sex hormones, talked about your story, weight loss. But in this episode, we're going to talk more about what we can do to kind of overcome kind of the negative symptoms of hormones changes. And we talked about too how hormone changes, they're natural, it's going to happen. But we kind of want to talk more about what you do and how you help people in your clinic. So we had touched on HRT and bioidentical hormones. So let's just start with that. What is bioidentical hormones? What's HRT? How does all that work?
Sure. So we'll start with some definitions. So HRT all that means is hormone replacement therapy. So that's just the basic terminology we use. Bioidentical hormones are essentially plant-derived, so they're not synthetic, and then they compound it into the forms that we use. So to kind of give an example, so bioidentical hormones would be what we call like micronized progesterone. It's just pure progesterone chemical derived from plants, and then we compound it into a capsule or a cream. And then there's also synthetics. So if you talk about birth control medications like Ella, those are synthetic hormones. Back in the day, initially hormone replacement started with equine recombined hormones. So essentially, they take horse urine, then they kind of separate the hormones from that, and then that's what they used. And they was usually combined, so it was really hard to separate one particular molecule from the other. So they combine in an appropriate ratio, and that's what they start out with, and then kind of evolved into a synthetic, and that's where all the birth control medications really came up as. And then now we're kind of more, then people realize that those were having undesired side effects. So now we're more in a natural hormone replacement.
That's mind-blowing to me. How can you get a plant-derived hormone that humans are producing that controls their, for women, for their periods and things like that? How is that actually working?
Yeah, so basically, I mean, they essentially, so think of this way. So we all know that soy causes more estrogen because soy actually has the estrogen molecule in there. I unfortunately don't know enough plant biology to know if they actually use it for something. But most, most living organisms shares pretty much relatively the same chemicals. So that's pretty much how they derive it. I think now they're also, a lot of times they also can use bacteria to produce specifically certain hormones as well. I'm not sure if that's really in the mainstream right now yet, but right now it's basically, they pretty much take the plants that are high in estrogen, they distill it down, then they pull out estrogen by itself. That's natural, and then that's what we use.
So this applies to, we've talked primarily about estrogen, progesterone, and testosterone.
Yes.
This applies to all of them?
All of them, yes.
Wow.
And the same thing with thyroid. And the thyroid is actually a little bit more different. So thyroid, most of the time they use synthetic thyroid, which is synthroid, synthetic thyroid. But when we replace thyroid, we actually use desiccated thyroid. So it's actually bovine-derived thyroid. So they take the pig gland, and pig actually produces the exact same ratio of T1, T2, T3, and T4 as humans do. So they've been using that since Roman times. So we kind of fell out of favor once major pharma came onto the scene, and now it's kind of swinging back into favor again.
Wow, that is. We could have a whole episode on getting nerdy here.
We should really delve into the
my
history.
Science background, my science brain light bulb is like, ask all the questions, but we're going to stay focused on the basics of what we want to talk about here today. So with hormone replacement, you talked about bioidentical. So that's really important to know, is when you're talking about replacing hormones as we age, you want them to be bioidentical, not synthetic.
Absolutely, because bioidentical is the same hormone that your body naturally makes. We're just going to replace and get more. And we can also predict it very well on how it's going to interact with you. Synthetic hormones are the ones that cause severe side effects. For example, everybody knows about the bodybuilders in 70s and 80s that used to abuse testosterone. Those are synthetic testosterone. You really can't get that to level bodybuilding with natural testosterone without having other very severe complications. So we really, really, for anybody that's seeking out care, always request bioidentical hormones. We try to stay away from synthetics.
So if someone is taking bioidentical hormone replacement, they are not going to be bulking up. This is not like they're taking steroids, is what you're saying, right? Because I would think a lot of people, when you think about taking testosterone, you're like, okay, if I have to do a drug test, I would not pass. So that's not the case here.
No, absolutely not. And then all we do is replace it to the point in your 20s and 30s. So we don't even try to overshoot it. So our goal is to get you back to quality of life that you had when you were younger. And then I don't practice pushing into more complicated sites. So I don't really work with synthetic hormones of any kind because of the side effects. But we always try to replace it to where you were naturally. So in your 20s and 30s. So unless you look like a bodybuilder in your 20s, you're probably not going to get there.
Yeah. Yeah. Well, and it's not just replacing, it's just getting you back to level, right?
Exactly. So
should everyone be on hormone replacement therapy at some point? What's your opinion?
I'm a big proponent that you should be. And then that's we based on both symptoms and also lab work. So we do lab work when you first start to just give us a baseline, and then we check lab work every 3 to 6 months, depending on how we're changing the dosage. Once you're at a baseline and we know what your levels are, because everybody's levels are going to be different. Once we get you where you need to be, then we check it every 6 to 12 months, essentially, once we get you stable.
Yeah. And so when would somebody come in to see you? Is this like before perimenopause? Is this like when they start feeling symptoms, or are they supposed to be a little bit more on it?
Yeah. So if you're feeling symptoms, of course, that's when you need to come see me.
Right.
And everybody's symptoms are a little bit different as well. And then some people will get the symptoms very early. Some people won't get the symptoms till very late. So usually I recommend, come and see me around, if you don't have any symptoms whatsoever, come and see me around 45-ish of age, because then at that point, you're probably in the middle of perimenopause. We can stay ahead of menopause, get you the benefits you need before things go downhill. But if you're having symptoms, that means you should be seeing me already.
Interesting.
And we talked about in episode 1 how symptoms can be very interesting and unique too, because oftentimes when we're talking about hormones changing, we think about women just because we have hormones changing every month. But we talked about andropause in episode 1 as well with men and how their testosterone levels naturally decrease. And some of the symptoms that you had mentioned there were even just like more achy or more muscle fatigue or like what are some of the maybe not well-known symptoms that people should be looking out for that would be pointing toward, hey, you should get your hormones checked?
Sure. So I think that we can start with a good resource for your listeners. So for men, we do what we call aging male symptoms. It's AMS. You can just Google it. It'll get you literally a list of symptoms, and you scale it from no symptoms to very severe symptoms, and it gives you a score at the end. That tells you roughly how bad of andropause you're in. And we do this for every male patient that comes in. And then that tends to, that kind of puts things in perspective. And we can also use that subjective score to track your symptoms as well, see how you're feeling, because that is a part of our treatment. So aging male symptoms, AMS, just Google it. That's perfect.
And we can include that link in the show notes too.
Absolutely.
Yep.
And for women, it's menopause rating scale. So once again, it's very based on symptoms, and they pretty much go through all the main symptoms that a female can experience, a woman can experience as they go through perimenopause, and gives you a score at the end. And then once again, it kind of helps tell you if you're mild, moderate, or severe menopause. And then we also keep track of that. So those are really good ways to just do it at home and see where you land. If your score is 0, then it's great. You don't have any symptoms. If your score is very low, that means it may not be you're going through menopause. That's why you need to have a consultation with me to see, is menopause what's causing symptoms, or if there's some other extraneous factor that's causing symptoms. For example, like if you just feel tired all the time, but you don't exercise whatsoever, maybe it's now your menopause or andropause. It's just that once we get you into the gym, within 3 weeks, you start getting that energy level. So a lot of times I kind of look at the holistic picture to look at that. Some of the not well-known symptoms would be really emotional symptoms. So like some people can say, hey, I just don't feel like, or apathy would be a good word to put it. Like you just don't want to do something. And a lot of times it can be like, oh, she's just PMSing, or she's just having a moody day today. But if you're 35 plus and that's not normal for you, then you may just start having the perimenopause. Or you just notice that my back's really achy every time I wake up this morning, or my joints ache. I feel like I'm having flu. It may not be the flu that's affecting you. It may just be starting to have this perimenopause period, so you need evaluation. So those are some of the least well-known.
Okay. And then once you start HRT, are you on it for life?
So I tell them you can stay on it as long as you want to feel great. I'll get you some concrete numbers. So for a male, let's say for testosterone, when you're 20, it's levels 800. At 40, it might be about 400, and 60, maybe 200. So if we start you at 40, we can replace it up to 800. And at age 60, you're like, you know what, I really don't want to do this anymore for whatever reason. Once we stop it, it will drop down to what you're genetically predisposed to make. So it's not a permanent thing. But if you want the quality of life, you'll continue. But sometimes things happen in life that, or you may not be interested in the process anymore. Then we can just titrate you off gently, and then you'll go down to genetic predisposition.
Okay. And what does HRT actually look like? Is it creams? Is it shots? Is it pills? Is it a different combination depending on the type that you're taking?
Sure, yeah. So it really depends on both personal preference and also the hormone itself. Progesterone is best used orally or intravaginally. It's just too big of a molecule to be absorbed well through a cream. So we stay away from that. Estrogen, once again, it could be a topical or oral. We usually do topical. It tends to have better, at least less side effect profile topically while having the benefits. And you can also even get patches for estrogen. So it's once a week. It can be once a week or daily. It really depends on personal preference and how strict of a schedule you have. Testosterone can be topical or injectable. Usually for women, we do topical because it's much, much lower dose. For men, we do injectable because it's a much higher dose and we can be a little bit more reliable. But if you're afraid of needles, then we just do topical. And then orally, testosterone you can't take orally because your stomach acid breaks it down too quickly, so it doesn't work.
We had talked about how the bioidentical hormone replacement, those hormones are derived from plants. Can you eat certain plants to increase your hormones naturally? So, you'd use the soy example. If I had low estrogen, could I just drink soy milk? And would that help increase my estrogen. Is that an option for any of these?
It helps in balancing things out. So it doesn't really increase it to the level we usually do, but that's why I recommend always taking the whole foods, because honestly, there's still quite a bit of research that's coming out on which hormones are more in one plant or another. So the best way you can really do is keep a very wide variety of foods and just eat whole foods. Because anytime you process it, that compound gets broken down. So if you just cook at home, keep everything natural. Of course, I always recommend buying local if you can. That usually tends to be the best thing. Unfortunately, I don't think there's a particular no real study that says, hey, if you eat soy, your levels will go up by this much, or if you eat peanuts, your levels will go up by this much. There's just not enough data for that.
Right. So like when when somebody sees you have a particular level you want to get them at, and like how much to give them for that, right?
Yeah. So we use, exactly. Yeah. So we use blood work to kind of help define that, and also we use symptoms to help define that as well. Okay. So we use a both combination.
Yeah.
Okay, and then another question that I had, which is kind of unique, but Dre and I are both in our mid-30s, and so we're freaking out now. No, I'm just kidding.
I mean, maybe a little.
But we're in that, perimenopause type age range is coming quickly. Can you predict your future based off of how your parents have aged? So if we look at our mom specifically, since we're sisters, does how her menopause journey, how it went, is that likely how ours will go, or is that completely irrelevant?
No, it's actually very related. So it's, let's say if your mother stopped having her menstrual cycle at age 55, then you'll probably experience that roughly within 2 to 3 years of that, plus or minus 1 or 2 years. So it's actually genetically, you can predict based on how your parents are. Of course, there's some lifestyle factors like exercise level and stress level, but if they have relatively the same lifestyle, you can look at your parents and say, well, this is when my dad started, not feeling so great, or starts complaining about aches. And if you're a male, then you can predict that's when it's going to start happening to you as well. So it's very genetically linked.
There's going to be a lot of phone calls happening after this episode.
Yeah. Mom, when did you start getting your period?
Yeah.
When is that?
Well, even for men, I just find it so interesting and so important that men can definitely benefit from this conversation just as much too.
Absolutely.
So I think you already kind of touched on this, but I do want to just kind of walk through what this journey actually looks like with you. So you said that you do testing up front, and it's typically a blood test that's going to give you the current levels of their hormones, correct?
Yep. So it's so it can get pretty complicated. So we'll kind of do like a overarching view. So for men, when they come in, we'll once again it's an hour-long free conversation. We just kind of sit down, get their life goals, see what their journey has been so far, and then we do blood work. And blood work for testosterone is pretty simple. It tells us what your levels are at the moment, and then we kind of replace it to get you up to what your peak levels would be. And once we start replacing it, we'll adjust it based on your symptoms. And then we do other blood work to make sure you're not having any side effects with that as well. For women, it's a little bit more complex. So as when we talked about in episode 1, you have the perimenopause area where it's absolutely chaos. So during that time, blood work really won't give us too much information on progesterone or estrogen, because it's going to be all up and down. So it's really hard to predict. It depends on how you're feeling that day. That will change quite a bit as well. So that is particularly more based on your symptoms. So, and then based on symptoms, once we start replacing it, we usually start, I always call it low and steady, just to see what kind of side effects you're feeling, and then we'll kind of increase the dose. There is an optimal dose we want to get to, but it also depends a lot on your height, your weight, and your lifestyle. So it's nothing's concrete and written in stone. The only thing we really test for women is testosterone, once again, because that's pretty steady. It doesn't fluctuate from day to day or even from week to week. So for that, when we're replacing, we always keep an eye on the testosterone. But we do test other metabolic lab work to make sure that, which we'll talk a little bit more in detail later, is make sure you're not having any other side effects.
Okay. And then as we age, our natural hormones will continue to decline, I'm assuming. So then how often did you say you're retesting and kind of just like keeping eyes on on how this progresses?
So initially, it will be every 3 months when we first start. But all my patients have a direct contact with me, so they always have my cell phone number, and I don't have a secretary. So it's just every time they receive emails or texts or calls, it's always me directly. So most of my patients keep in touch with me pretty regularly, sometimes even from week to week when we first start. And as we get things stabilized, and then there's not too much else for us to talk about or address, things tend to kind of get spaced out. I try to see my patients every 3 to 6 months, just to kind of touch base, see how we're doing. And the testing happens every 6 to 12 months once we get you on a good level. So we do have a very frequent, regular contact.
Okay. And then your way of working with people is a little bit unique of a model, I believe. You do more of a subscription model. Is that correct?
Yeah, that's correct.
Okay.
So the subscription model includes the medication and my fee. And since the insurance does not cover this service in general. And the nice part of the subscription model is I also have I try to keep my panel limited. That means I also have pretty wide availability. So if you go on to look at appointments, you'll see I have very wide availability both mornings, afternoons, evenings, even on weekends. So I try to be available as much as I can for my patients.
Awesome.
Amazing. Wow.
Yeah, this is great. Thank you so much for helping us walk through aging, make it a little bit less scary, and make us feel like there's hope, that we don't have to be roller coasters of emotion if we don't want to be.
I'll try to make 60 the new 30, so that's the goal.
Yeah, for sure. But next episode, we're going to be diving into maybe some unique ways that hormone replacement can help. We're going to be talking about PCOS. We're going to be talking about cancer. We're even going to be diving into the world of peptides. So if you've heard that word, but you don't really know what it is, stay tuned for the next episode. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.